My name is Karen Kaisa. I am going to talk about physical therapy for chronic pain mitigation and opioid use reduction among people living with human immunodeficiency virus. Definition: people living with HIV may be at increased risk of experiencing both chronic pain and opioid dependence. Human immunodeficiency virus is a virus that attacks the body's immune system. If human immunodeficiency virus is not treated, it can lead to AIDS, acquired immunodeficiency syndrome. There is currently no effective cure. Once people get human immunodeficiency virus, they have it for life. But with proper medical care, HIV can be controlled.
Millions of people live with HIV, a disease that weakens the body's defense against ordinary infections.
The body's defense is the immune system, made up of white blood cells, antibodies, and other cells. CD4, a type of white blood cell, fights off invaders.
But HIV attacks CD4 cells. The HIV life cycle begins when HIV attaches itself to the CD4 cell and transfers its proteins and genetic materials into it.
Next, an HIV enzyme called reverse transcriptase converts HIV RNA into HIV DNA, while an integrase enzyme integrates HIV DNA into the host CD4 cell's DNA.
Then, the protease enzyme processes the produced HIV material for assembly into an immature virus.
Finally, mature HIV materials are released into the body, where the cycle starts over again.
There is no cure for HIV, but antiretroviral medication or ARVs reduce HIV reproduction by interrupting the HIV life cycle.
Entry inhibitors prevent HIV material from entering CD4 cells, while reverse transcriptase inhibitors stop the reverse transcriptase enzymes from converting HIV RNA into HIV DNA.
Later, integrase inhibitors block HIV integrase enzyme from integrating HIV DNA into CD4 DNA, while protease inhibitors block the protease enzymes from enabling the production of new HIV material.
By learning more about HIV and ARVs, you are better able to adhere to HIV treatment and protect others from getting infected.
Application in physical therapy. The study of medical medicine cases of the development of an innovative physical therapy intervention to discourage the practice of medicine and the use of opioids in a multidisciplinary clinical trial of human immunodeficiency virus. The participant received a physiotherapeutic package that consists of manual therapy, eccentric prescription, estimating nervous transcutaneous arterias, and acupuncture strategy. The results before and after the intervention were measured for the two information the use of opioids and measure of life. Pros and cons. Pros. This study has shown that physiotherapy is effective as a non-pharmacological strategy to mitigate chronic pain in the general population. After the intervention, all participants report a decrease or complete elimination of back pain measured on the 0 to 10 numerical rating scale and opioid use measured in milligram morphine equivalent. Cons. Unfortunately, physical therapy helps the pain of people living with HIV. However, it is not a definite cure for this disease. Studies and various clinical trials are currently being carried out for the benefit of a cure for the population.
Getting to know your doctor, eating healthy, getting into support groups, loving yourself, and exercise.
After my diagnosis, I began to receive nutrition and exercise advice.
Working out, watching diet.
You need to adopt a whole foods diet, which is loaded with fruits and vegetables.
I'm eating quinoa, I'm eating kale salads, spinach, broccoli.
Protein should be a big focus, lean meats, fish.
A patient who has HIV may experience weight loss, so you may have to do a diet that's gonna help promote weight gain at times.
You want to include healthy fats.
Those are foods like nuts, avocados, nut butters. It's important for patients with HIV to take into account food safety rules. Because their immune system's compromised, they're more likely to catch infections from poor handling of foods.
You want to make sure your water is really as clean as you can get it.
So get acclimated with the temperature you're supposed to cook your meat.
You even want to put a filter maybe in your shower head.
The most important thing for them is going to be compliance with your medications.
And that becomes sometimes the most difficult part because you just go, God, I just don't want to do it anymore. And then you take a deep breath and you suck it up and you take your meds and you move on with your day.
Stress management is key. People living with HIV who include daily meditations or daily sessions of prayer have much better outcomes.
And it was really taking me to a place that I felt such a sense of calm.
This is not woo-woo, this is science. The easiest way to meditate, simply follow your breath.
And just breathe. Saying nothing, just breathing.
Exercise is perhaps the most powerful antidepressant that you can do.
I do a lot of yoga.
If your body is flexible, you become flexible.
The number one thing for someone going on a regimen is to have that support.
It's good to talk to someone else outside your box.
Find a therapist.
Talk to people. They're there for you. I'm there for you.
Just because you have HIV does not mean that you can't have a healthy, happy, long life. Your wellness is very much up to you, and it's time to make a commitment.
Update in Ecuador. In Ecuador, the main treatment for people with HIV is antiretroviral therapy. However, physical therapy for people with HIV is still not common in our country. Hopefully, this clinical investigation will open a door to various effective treatments for this disease. Conclusion. The results of this case series suggest in this simple that the described physical therapy intervention is a feasible approach to mitigating chronic pain and opioid use among people with HIV and should be implemented on a larger scale for maximum possible effect and improve the quality of life and opportunities that this disease limits.